Oh, we are seeing a steady rise in sexually transmitted infections nationwide. Though some states are experiencing these issues more than others, a local infectious disease physician says Iowa is impacted by the rise more than most other states. A Local 5's Larissa Leone joins us with how Iowa is affected by the increase of cases.
Stephanie, a local infectious disease physician, tells me Iowa's impacted by the rise in STI case numbers more than most other states, saying the pandemic played a big part in the increase, but other factors are at play.
There are several factors that play into this, of course.
Dr. Megan Srinivas is an infectious disease physician as well as an elected representative for the Iowa House. She has worked on in-depth studies on STIs and has seen a steady increase in cases here in Iowa after the pandemic.
People were not having access to public health entities as much. They weren't going in and seeing their doctors as much. So they weren't having the same prophylactic discussions on how to prevent STI spread.
Although Dr. Srinivas cites higher case numbers in rural communities, Madison Van Gundy with the Polk County Health Department says Polk County is seeing the same trends locally as nationally, saying the health department is working to combat the rise in cases.
We are doing more testing, than we've ever done, which I think could also be contributing to an increase in number of cases that we're seeing.
Van Gundy says Polk County resources for STI help are set at a low cost.
Here at Polk County, it's $10 if you live in Polk County and $25 if you live outside Polk County. But if someone does test positive here, medication is free.
Dr. Srinivas says even before the pandemic, cases were still steadily growing, saying politics play a hand in the problem. With polarization in reproductive and sexual health rights, Dr. Srinivas says the way to see progress is by putting people's health before policies.
I do worry that if we continue to have more politically motivated discussions, rather than thinking about what's best for Iowans, the amount of care in our state is going to contract.
Currently, Dr. Srinivas is working on a case study with the World Health Organization to see how the pandemic impacted access to sexual reproductive health care. Stephanie?